Now, interestingly, another medication these are my words, not medical advice, I'm just saying my words, that we probably just took for granted as being there. You might want to talk about Nurofen and codeine, so on, is now on a list which carries severe warning about using it. In this instance, we're talking Phenergan. Now, I reckon most parents, and tell me if I'm wrong out there, would have had some kind of interaction with Phenergan when your child was suffering from teething issues, for example, just as an example, that Phenergan was given to them. Now the recommendation coming out from the Therapeutic Goods Administration is to not give it to any child under the age of 6 years of age. Why is it so? Let's go to Dr. Michael Page, President of the AMA here in WA, the Australian Medical Association. Thanks for your time, Michael.
Good morning, Gary.
What can you tell us about why this is now the thinking, given that Phenergan has been, well, I'll say accepted, but certainly something well used by parents over many, many years?
Yeah, look, it certainly has been something that's been well used, Gary. Phenergan's an antihistamine. In other words, its intended purpose is really for allergies, for hay fever, for skin reactions like hives, things like that. And you're right, it's been used for many years for that, but it's also been used for many years as a bit of a sedative, although that's not its intended purpose and it's not licensed for use as a sedative. As you've alluded to in your introduction, many parents have used it for children who are teething, even though it doesn't have any analgesic effect. It's not a painkiller. People have used it for keeping their children quiet on long flights or drives, things like that. And that's certainly how it has been used, even though it's not supposed to be used that way. But it's not safe in young children, and that's the issue. So it used to be used down to around, because it's got a strong sedative effect, and it used to be used down to children who are only a few months old. A few years back, that was changed, so it was not supposed to be used below 2 years, because in very young children under 2 years, it can stop them breathing, so it can actually have fatal side effects in rare cases. But now the TGA has taken an even harder line on it and said it shouldn't be used under the age of 6. And for those sort of children between the age of 2 and 6, the concern is probably not so much around it stopping them breathing. It's more around the fact that a proportion of children will have really severe psychiatric side effects like hallucinations, where they're seeing things or hearing things that aren't real, extreme agitation, irritability. So even though most children will get a sedative effect, a proportion of children will have kind of the opposite reaction. So it's just been deemed to be not particularly safe. And it was never intended for use as a sedative anyway, and there's plenty of other antihistamine options for children with genuine allergies.
Well, there you go, and that's the point. Okay, so allergy-wise, but what about if your child is going through teething and it's horrific and they're not sleeping and so on? I mean, is there a suggestion there that, because, again, parents shouldn't feel guilty because they might have given their child some drops of Phenergan to help with that discomfort. So what can they do instead?
Oh, certainly no one should feel guilty about it, but it's really about treating the actual symptoms that are occurring. So the poor sleep is secondary to pain, so the pain should be managed using, simple things like paracetamol, Nurofen, ice rusks, all those sorts of things. And that's really the best advice. Sedatives in children in very young children are just not recommended because they're not safe. It's a very rare instance in which a genuine sedative is recommended in young children because it can stop them breathing, and I don't think we want that.
No. Did you know how they'll police this one, though? We've certainly seen other medications just literally taken from the shelf and only sort of through prescription by a doctor. What'll happen here?
Phenergan sits in this schedule called Schedule 3, which means it has to be kept behind. So it doesn't require a prescription, but it does have to be kept behind a counter in a pharmacy, and a pharmacist is themselves supposed to be involved in every sale of it. And therefore, you might just expect and hope the pharmacist to ask the right questions and provide the right advice to patients or to parents requesting Phenergan for their children to ensure it's being used properly.
It's fascinating, because I'm going back through my mind now, Michael, of a time when our kids were little, and I remember the teething issue. And I'm not going to say where, but I certainly know that there was a pharmaceutical company and their pharmacy front store that would actually have what they call teething elixir, which I know was a combination mixed with Phenergan. And there was nothing wrong with using that at the time, and it did seem to have an effect. I mean, is that all that's going to change dramatically, I'm assuming?
Look, I think times have changed a little bit, Gary, and there's a much greater focus now on safety, and as we accumulate more data around, so for instance, 40, 50 years ago, sudden infant death syndrome wasn't something that was talked about, but it has many causes and contributors, and if one of those contributors is sedative medication, and now we're a bit more aware of that, then we need to move with the times in terms of regulating medicines to ensure that they can be used safely, and to ensure that to ensure they're used effectively, and that those rare side effects, even though they're extremely rare, are of course devastating. I mean, a death of a child from respiratory depression from an antihistamine that didn't really need to be used is a devastating outcome, and we don't want to see any of those.
All right. Thanks for taking us through it, Michael. Appreciate your time today.
Anytime, Gary.
Dr. Michael Page there, the President of the Australian